My name is Marian Lagerwey. I'm a relationship coach and an energy healer and the CEO of Alleviate Pain. Fibromyalgia Awareness. Fibromyalgia is a chronic disorder that affects millions of people worldwide. It is characterized by a widespread pain throughout the body, along with other symptoms such as fatigue, sleep disturbances, and cognitive difficulties. And despite it being a common condition, fibromyalgia is often misunderstood and misdiagnosed, and that leads to significant challenges, especially for those who suffer from it. In this video, I will dive deeper into what fibromyalgia is, what its symptoms can be, and what can cause it, and then some treatment options. What is fibromyalgia? Fibromyalgia is a chronic disease that affects both the nervous system and the muscles, bones, and soft tissue of the body, which can cause widespread pain overall. And this pain can be severe and debilitating, making it very difficult to perform daily tasks and enjoy a good quality of life. In addition to pain, fibromyalgia also causes other symptoms such as fatigue, sleep disturbances, and cognitive difficulties. The impact of fibromyalgia on your life in general is big. You are suffering with this disease every day, not just today or tomorrow, not for a week or a month, but for a long time. And because it's not visible to other people, they will often not understand what you're going through. They will only see what they expect. It is especially a very big influence on your relationships, as chronic pain and fatigue can lead to less physical intimacy and a more difficult emotional connection between partners. Many individuals with fibromyalgia also struggle with feelings of guilt and shame because they believe that their condition is a burden on their loved ones. And it's important for both partners to communicate openly and honestly about their needs and feelings, and to work together to find ways to support each other. Symptoms of fibromyalgia. The symptoms of fibromyalgia can vary from person to person, but here are the most common ones. Widespread pain is the primary symptoms of fibromyalgia, and it's often what prompts people to seek medical attention. This pain can be difficult to describe, but it's typically experienced as a deep, persistent ache that affects many areas of the body, including the muscles, bones, and soft tissues. The pain associated with fibromyalgia is often described as widespread because it can affect many different parts of the body, including the neck, shoulders, back, hips, arms, and legs. It can also be accompanied by a feeling of tenderness or soreness in the affected areas. And one of the unique features of fibromyalgia pain is that it can be triggered or exacerbated by physical or emotional stressors, such as illness, injury, anxiety, or depression. For example, someone with fibromyalgia may experience a flare up of pain and fatigue after a period of increased physical activity or a stressful event. Widespread pain is the primary symptom of fibromyalgia, and it is often what prompts people to seek medical attention. This pain can be difficult to describe, but it's typically experienced as a deep, persistent ache that affects many areas of the body, including the muscles, bones, and soft tissues. The pain associated with fibromyalgia is often described as widespread because it can affect many different parts of the body, including the neck, shoulders, back, hips, arms, and legs. It can also be accompanied by a feeling of tenderness or soreness in the affected areas. One of the unique features of fibromyalgia pain is that it can be triggered or exacerbated by physical or emotional stressors, such as illness, injury, anxiety, or depression. For example, someone with fibromyalgia may experience a flare up of pain and fatigue after a period of increased physical activity or a stressful event. Sleep disturbances are also frequently experienced symptoms of fibromyalgia. and that can have a significant impact on a person's overall health and well-being. People with fibromyalgia often report having difficulty falling asleep, staying asleep, or feeling rested after sleep. And these disturbances can lead to feelings of fatigue, irritability, and difficulty concentrating during the day. Insomnia is one of the most common sleep disturbances experienced by people with fibromyalgia. Insomnia is characterized by difficulty falling asleep or staying asleep, waking up frequently during the night, and waking up way too early in the morning. People with fibromyalgia may also experience other sleep disorders, such as sleep apnea and restless leg syndrome, which can further disrupt their sleep. Cognitive difficulties, also known as fibrofog, is a common symptom that is experienced by many people with fibromyalgia. It is often described as a feeling of a mental fogginess or confusion that can make it rather difficult to concentrate, to remember things, or perform everyday tasks. Other common symptoms of cognitive difficulties in fibromyalgia include forgetfulness, difficulty with word finding, and trouble with multitasking. And these symptoms can be unpredictable and may vary in severity from day to day. Headaches are another common symptom experienced by many people with fibromyalgia. In fact, research suggests that up to 76% of people with fibromyalgia experience headaches or migraines. Headaches in fibromyalgia can vary in type, intensity, and duration. Some people may experience tension headaches, which are often described as a band-like pain around the head, while others may experience migraines, which are typically characterized by severe throbbing pain on one side of the head, along with other symptoms such as nausea, sensitivity to lighter sound, and visual disturbances. Irritable bowel syndrome, or IBS, is often also associated with fibromyalgia. It is not entirely clear why these two conditions are commonly linked together, but research suggests that there may be a shared underlying mechanism that includes abnormalities in the way that the brain processes pain signals and changes in the gut microbiome. IBS is a gastrointestinal disorder that affects the large intestine. It is characterized by a group of symptoms that can cause discomfort and pain in the abdominal area, as well as changes in the bowel movements. And these symptoms can include abdominal pain or cramping, bloating, gas, diarrhea, or constipation, or a combination of the two. Fibromyalgia is a chronic pain disorder that can have a significant impact on a person's physical health, but it can also affect their mental health. In particular, people with fibromyalgia are at a higher risk of developing depression and anxiety and other mood disorders. Depression and anxiety can be debilitating conditions that can have a significant impact on a person's quality of life. Depression is characterized by feelings of sadness, hopelessness, and loss of interest or pleasure in activities that were once enjoyable. Anxiety, on the other hand, involves excessive worry or fear about everyday situations or activities. And people with fibromyalgia may experience both depression and anxiety, which can make it even more difficult to manage their chronic pain. There are many reasons why fibromyalgia might be linked to depression and anxiety. One possibility is that the chronic pain and other symptoms of fibromyalgia can be stressful and overwhelming, which can lead to feelings of anxiety and depression. Additionally, research suggests that there may be an underlying biological mechanisms that link fibromyalgia, depression, and anxiety, such as abnormalities in the way that the brain processes pain signals and changes in levels of neurotransmitters like serotonin. Causes of fibromyalgia. The exact cause of fibromyalgia is still not fully understood because it is such a complex disorder, but researchers believe that it's a combination of physical, emotional, and environmental factors that contribute to the development of fibromyalgia. And here are some of the possible causes and factors. One potential cause of fibromyalgia is genetics. Research has shown that fibromyalgia often runs in families, which suggests that there may be a genetic component to the disorder. However, scientists have not yet identified a specific gene or group of genes that could be responsible for fibromyalgia. It is likely that multiple genes are involved and that the environmental factors may also play a role. Another cause of fibromyalgia could be abnormal pain processing. People with fibromyalgia may have a heightened sensitivity to pain due to changes in the way their nervous system processes pain signals. And this can cause them to experience pain in response to stimuli that would not normally be painful, such as a gentle touch or a change in temperature. Additionally, people with fibromyalgia may experience pain in multiple areas of their body rather than just in one specific location. Abnormal pain processing in fibromyalgia may be related to changes in the levels of neurotransmitters in the brain, such as serotonin and dopamine. It also may be related to changes in the way the brain and the spinal cord communicate with each other, leading to increased pain sensitivity. Hormonal imbalances, particularly in women, are also thought to be a contributing factor to the development of fibromyalgia. And this is because of hormones like estrogen and progesterone play a role in the regulation of pain perception and sensitivity. Changes in hormone levels, such as those that occur during pregnancy, menopause, or menstruation, may trigger the onset of fibromyalgia symptoms or exacerbate existing symptoms. Trauma or injury is another potential cause of fibromyalgia. Some people develop fibromyalgia after experiencing a traumatic event such as a car accident or physical assault. In other cases, a physical injury or repetitive stress injury may trigger the onset of fibromyalgia symptoms. And this may be due to changes in the way that the body processes pain signals or to the changes in the levels of neurotransmitters in the brain and the spinal cord. Infections may also trigger the onset of fibromyalgia in some individuals, especially certain infections such as Lyme disease, hepatitis C, or Epstein-Barr virus have been linked to the development of fibromyalgia. It is assumed that these infections may cause changes in the immune system or the nervous system that leads to the onset of fibromyalgia symptoms. Treatment for fibromyalgia. There's currently no cure for fibromyalgia, but there are several treatment options available to help manage the symptoms and improve the quality of your life. I believe that it's important to take a comprehensive approach to managing fibromyalgia, and this may include a combination of traditional medical treatments such as pain medications and physical therapy, as well as alternative therapies such as acupuncture, massage, and mindfulness meditation. These treatments can help reduce pain, improve sleep, and increase an overall feeling of well-being. Here are some of the most effective treatments. Lifestyle changes. Making changes to your diet, exercise routine, and sleep habits can help reduce symptoms of fibromyalgia. A balanced diet that includes plenty of whole, nutrition-dense foods can help reduce inflammation and improve overall health. Making changes to your home or work environment, such as reducing exposure to toxins or using ergonomic equipment, can help reduce pain and other symptoms. I do think that this is important in all circumstances in life. It is much better to prevent than to heal afterwards. Alternative therapies. Many people with fibromyalgia find relief through alternative therapies. The more natural the treatment is, the less negative impact it has on the whole system from all the side effects. Mind-to-body techniques such as acupuncture or acupressure, massage, meditation, yoga, EFT, Tai Chi, or Qigong can help reduce stress and promote relaxation, which can improve the symptoms of fibromyalgia. Energy healing techniques such as Reiki, acupuncture, and acupressure, Qigong, or EFT can also help balance the body's energy systems and reduce pain and other symptoms. Cognitive behavioral therapy, or CBT, is a type of talk therapy that can help people with fibromyalgia to learn coping strategies for managing pain and other symptoms. And talking is always good, but be mindful about who you talk and listen to. Medications. There are several medications that can help manage the symptoms of fibromyalgia, including pain relievers, antidepressants, and anti-seizure drugs. And even though I am not a big fan of chemical drugs, I do understand that there are circumstances in which it may be necessary to take some of them. But I do recommend to keep that at a minimum because of the side effects they have. Self-care. Taking time to care for yourself, such as getting enough rest, engaging in enjoyable activities, and practicing self compassion, can help reduce stress and improve your overall well being. All of the above can help you to take better care of yourself and improve the quality of your life in general. I personally know people that have been suffering with fibromyalgia, and all of them have found ways to either deal with the situation or completely get rid of the symptoms. They also have used different methods to do so. Therefore, it is important to realize that each of you is different and that what helped someone else might not be right for you. But I do know for sure that it's possible to get rid of all the symptoms. You just have to find the right way for you. One of the things that I know to be very helpful in many physical and mental health situations is EFT or tapping. And here I have an EFT tapping script that will help you to change some of the things in your situation. EFT is a tapping system that is derived from acupuncture. It uses the same meridians or energy streams in the body, but without the needles. We just tap on the acupuncture points. We now know that our mindset and thoughts are also the big contributor to the things we think, feel, and experience. So if you can change some of that, it will bring you relief. So let's start. All you have to do is just follow what I'm doing and allow the words to enter into your nervous system, into your subconscious. Do not worry about doing it correctly. This is a very forgiving system. If you omit a point or go in another direction, it doesn't matter. It will still work. Here we start with tapping on the karate chop point, which is the fleshy side here on your hand. 2 or 3 fingers will do that. And I'm going to say 3 long sentences, starting with even though. And as long as I'm saying that, you keep tapping on that, okay? Even though I'm struggling with fibromyalgia and it is impacting my life, especially my relationships, and I feel overwhelmed by the stress, I deeply and completely choose to love and accept myself. Even though it feels like the pain and suffering will never go away, and I blame myself for it, I deeply and completely choose to love and accept myself anyway. Even though I feel trapped and helpless, I now know that I have the power to release the stress and work towards feeling calm and at peace. And I choose to take responsibility for my situation now. Now we will tap through the points, and while I'll be saying some phrases, you don't have to do anything with the phrases, just listen to them and feel into them. The tapping points we're going to use are very easy. You can use either side of your body, both sides or just one. You can swap over, it doesn't matter, it's all okay. We tap about 5 to 7 times. Just tap during the sentence that I'm saying and you'll be all right. The first tapping point is here, just on the edge of the eyebrows, either this side, or both. Then we have here the corner of the eye, just around that, either this side or that side or both. Then underneath the eye, just on the bottom lowest point here, just like that, same thing. And then we have the under the nose, just in the middle, just in the crease there, here under the chin. And you can either use your fingers like this or like that, whatever you think is most convenient. The next thing is here in your collarbone, is you've got the little thing with the clavicle here, and then you've got that bone. Just when that bone is receding a bit, that's where you tap. Okay, either this side or that side or both. And then the next one is here underneath the arm. It's on your bra strap place. Yeah, either you tap like this or like this. It's possible as well. And then the last one is on the top of your head, just in the middle, with a flat hand like that. Okay. As I said before, it doesn't matter if you skip a point, if you stay too long on one and then go to the next like that, or if you go like, I don't know anymore. Yeah, it doesn't matter as long as you tap. And I'll be doing the tapping with you. Yeah, so you can just look at me and do what I do. Then you'll be all right. Then you'll be perfect. Okay, right, here we go. Start with the point of the eyebrow. I feel trapped and helpless. I cannot handle this pain and suffering anymore. It is impacting every area of my life, especially my relationships. I feel like it's my fault, as if I am to blame for all of this. But the truth is, it is not my fault. I did not ask for this pain and suffering. It is okay for me to feel angry, frustrated, and sad about it, because it feels like the pain and suffering will never go away. And I feel so stressed out and overwhelmed. I do not want to be in this pain and suffering any longer. So it's okay for me to feel angry, frustrated, and sad about it. It's fucking up every area of my life, especially my marriage. And even though it sometimes feels like it's my fault, that I am to blame for all of this, the truth is that I am not to blame. I did not ask for this situation. I did not do anything to deserve this. But it is time for me to take responsibility for my situation. It is time to acknowledge that I have the power to change this, to realize that I can be in control. It will not be easy to begin with, but I choose to let go of the belief that I'm not good enough. I choose to let go of the fear that my relationships will suffer because of this fibromyalgia. I choose to let go of the anger towards my body for causing me pain. I choose to let go of the guilt and the shame that I feel for not being able to do certain things. I choose to accept my situation for what it is. I choose to focus on what I can control and not on what I cannot. I choose to find joy in small moments and victories. I choose to take responsibility for my emotional well-being, and I choose to be kind and gentle with myself. I choose to prioritize self-care and relaxation techniques. I choose to be honest and open with my partner about all my struggles. I choose to not let this fibromyalgia define my partnership. I choose to communicate my needs and boundaries clearly and openly. I choose to celebrate the love and connection that we have. And I choose to remember that I am not alone and that there is always hope. I choose to keep moving forward and finding ways to thrive despite my challenges. I choose to release the stress and anxiety that is weighing me down. I choose to acknowledge and feel into the pain and suffering, but not let it control me. I choose to work towards healing, calm, and at peace. I choose to take care of myself, physically and emotionally. I choose to let go of the blame and the shame. I'm not my illness. I'm just a person with fibromyalgia, but that does not define me. I'm still capable of living a full and meaningful life. And I choose to focus on what I can do rather than what I cannot. I choose to be kind and patient with myself. And I choose to celebrate my progress, no matter how small. I'm strong and I'm resilient, and I can get through this. I'm not alone in this. I have a support system, including myself. I choose to reach out for help when I need it. I am worthy of love and care, even when I'm struggling. Okay? Take a deep breath in and let it out. And check in with yourself and see how you're feeling right now. If there still is some emotional intensity around the issue, just repeat the tapping script again, or adjust it as you need it to address any of the specific emotions that were coming up. And remember to be gentle with yourself and take things one step at a time. Thank you.